much, sir. But before I start, I should say that sir always comes up after everybody's presentations and lets us know how fantastic it was. I think a big round of applause. I have never seen anybody who can teach nystagmus in such a way. And it's always difficult to take the stage after the star performer, yet I'll try. So what I'll be talking about today is the presentation.
Make it full screen, ma'am.
Okay. Present view. I'll be talking about the central compensation after vestibular deficits, the mechanisms and molecular basis. Now this is not going to be about what exact exercise will you give somebody for central compensation to onset, but this is more about what do those exercises actually do at a molecular level. How does this compensation occur? How is it that a labyrinthine deficit somehow compensates later on and the patient is able to lead a normal or near normal life? So to introduce, motor skills are acquired. We are not born with it. All motor skills, not only to do with labyrinth, all motor skills are acquired and perfected by repeated trial and error. So this is the basis when you give a Cawthorne-Cooksey exercise or a Branderoff exercise. These topics are largely under research right now. The information coming is about a decade old, and most of the experiments are animal experiments. So how animals learn and store memories have been a focus of a lot of research. Now to understand the mechanism, there are two terminologies that we'll be talking about, that is long-term depression and long-term potentiation. So to understand the neural basis of learning, there are cellular mechanisms happening. We'll discuss that in certain detail. So why should a neuronal system adapt? It's not only in relation to pathology, but even generally, as a child grows up, the cranium expands. In older age, you start wearing prescription glasses. For all this, we require the vestibular system to adapt for us to have a perfect balance. This and also the pathologies, various pathologies like benign positional vertigo, Meniere's disease, etc., require compensation at some point of time. So there is this term called motor learning. This is the mainstay of adaptive plasticity. This is used as a primary method of learning about the motor learning pathway. The vestibular ocular reflex is a very simple 3-neuron pathway. And that is why it is extremely beneficial to learn the motor learning on those 3-neuron pathways, because it's a very simple pathway. You can conduct various experiments and we know precisely the motor outcomes that happen with this pathway. We know the eye movements, we can record it with a VNG machine. And another model that's been used is compensation after unilateral labyrinthectomy. These are also largely animal studies. There's something called cross-axis adaptation. Now motor learning here, this motor learning what we're talking about is generally in the linear plane. There is cross-axis adaptation. That means that if your eyes are looking in a certain direction in front and your visual stimulus is coming from above, even that can be compensated. These mechanisms are yet to be learned. We are yet to find out how this is happening. So how has vestibular ocular reflex been studied? There are two ways of studying this. A less effective way is to give a prism or a glass and put it on an animal and then observe the VOR after the learning has happened. Now we do not know in this how the learning is happening, but we know that the animal or the subject is having a motor learning at the end of your compensation. There are exceptions. There are these studies which were very interesting. Now, most of the slides today, I'll be referencing a lot of studies because these are all ongoing studies here. So these were exceptions because in these studies, the actual motor learning procedure itself was studied. As and when it was happening, it was mapped. The purpose of this was to know at what exact site this motor learning is happening. Where we know it's central compensation, but where is the central compensation? What is the site? So let's talk about the normal vestibular ocular reflex. I think a lot of it has been said about it already, but what we basically know is when the head moves in one direction, the eyes move in the opposite direction at the same velocity. So the ratio between the two velocities has to be 1 for us to have a normal vestibular effect. You have a normal balance. Now this VOR is remarkable. It can compensate a head movement up to 360 degrees per second and at 25 hertz. But even this is too slow, because there are certain things, certain activities. For example, say you, sports especially. Tennis is one of the favorite examples I use. Vestibular ocular reflex cannot compensate for a ball coming from a different direction each time. This has to be learned. But how? There is no time for this reflex to act. Then how is this learning happening? So there is this feed forward mode. Feed forward mode means that there are certain particular strokes that I know this will come this way. It comes only with practice, not initially. When somebody starts off, they'll miss that stroke. Feed forward mode, repeatedly you see those strokes. Once you'll realize that, okay, this stroke is going to come this way, I can hit it this way. This is feed forward mode. But this too is insufficient. This too is insufficient, and that is where motor learning comes into place. Now, motor learning needs a perfect coordination between the vestibular input, the motor processing, and the visual feedback. So let's go into details of motor learning. So VOR itself goes into feed forward mode and then has motor learning to actually have a perfect balance. What does motor learning do? It monitors the errors. Over a long period of time, it monitors the errors, and then it uses these to guide the adaptive changes that are happening in the neuronal circuitry. This happens without conscious awareness. All this is called procedural learning, because the task is being performed again and again repeatedly. Again, the example of field sports, this is how motor learning is occurring. And like I said earlier, normal life circumstances also the motor learning helps you. Where is the motor learning occurring? Now there are experiments conducted on animals to know the exact site of motor learning. We know it is central. So central could be anywhere. It could be the cortex, it could be the cerebellum, it could be the brainstem. So there are two main hypotheses here. One says it's happening in the cerebellum. Another says it's happening in the brainstem. Till today, we do not have a clear idea, but there is good evidence about both, and there is good evidence negating both. So let's discuss what we know so far. So let's see the normal vestibular ocular reflex. I'll not go into the details of this, but this is basically the right labyrinth turning to the right, stimulating the ipsilateral medial rectus and the contralateral lateral rectus. Now, if this is a simple 3-neuron arc, where can memory be stored in this 3-neuron arc that helps you learn? There are just synapses here. There is no site where memory can be stored. And that's when the cerebellar loop theory came in. So in the vestibular nuclei, in the medial vestibular nuclei particularly, there are certain cells called eye head cells. These will collaborate your eye velocity with your head velocity, and then it will transmit. This eye head cell gets its input from the cerebellar loop. So that was one particular hypothesis, that probably the learning has happened in the cerebellar loop, and that is giving feedback to this simple 3-neuronal arc. So what did they do to the cerebellum to find out this loci? To test if it is actually happening in the cerebellar flocculus, is the most ancient part of the cerebellum. This is again a reference. This is a major study by Ito in 1972. He modified an earlier study and found out that the cerebellar flocculus is showing some responses when the motor learning is happening. Long-term depression, this is the first term. This is the most common mechanism by which the motor learning happens. So what gets depressed, what gets potentiated, we'll come to it in the next few slides. Long-term depression demonstrated in vitro. In vitro means this was not done in a subject or an animal. There were slices taken from the cerebellum. These were kept in solutions and then in vitro they were stimulated. Another term here is what were they stimulated by? Climbing fibers coming from the superior olive. The climbing fibers stimulated the cerebellum and caused motor learning. So climbing fibers and parallel fibers stimulation. So there were changes happening in the Purkinje cells within the flocculus, and that showed that probably this could be a site of motor learning. And another experiment where they removed the vestibular cerebellum and realized that motor learning is getting affected. So these were the evidences that cerebellum could be the probable site. Now, for the signals to reach the flocculus or the ventral paraflocculus, these are the two sites, it has to go from the eye velocity signal and the head velocity signal. Only then learning can happen. So how does it reach? Like I said, there are three nuclei here, inferior olive, pontine, nuclear prepositus hypoglossi. From here, there are fibers going up. The most important which has been studied so far is the climbing fiber. So the climbing fiber reaches the paraflocculus and gives it the feedback for motor learning to happen. Head velocity will go through the vestibular nuclei itself. So this is the latest hypothesis that why not there could be a motor learning site in the vestibular nuclei. We'll discuss that too. Now this is the lowdown of the learning which is happening in the cerebellum. So what exactly? It boils down to this. From the inferior olive through the climbing fibers, this synapse is the site of motor learning. What is the synapse between the Purkinje cell in the flocculus of the cerebellum and the parallel fiber? So the climbing fiber, parallel fiber, Purkinje cell, this synapse is where motor learning is happening. Later on we'll go into more details on how exactly, what receptor opens, how does this motor learning happen, how does long-term potentiation happen, how does the depression happen. And this is getting an input from the this will give an input of change in gain to the vestibular, to the cerebellar loop. From there, it goes to the brainstem and the vestibular ocular reflex gain changes. That was about the cerebellum. So those were studies done on the cerebellum to know if that was the site. Then there was another group which did similar studies on the brainstem. They said that the brainstem is giving these signals through what we call the gaze velocity Purkinje cell. All this is new. It's relatively new because it's unheard of, it's still coming up. The idea behind these experiments is someday, if we know the target, the exact target, there are immense possibilities with these kind of experiments. We could develop drugs that help potentiation. We could develop drugs that will help compensation. So that's why we need to know what exactly is happening in central compensation. So brainstem hypothesis, they observed the gaze velocity Purkinje cells were being stimulated from something from the brainstem. There were also changes observed in the cell responses following motor learning in total dark, and this was supposed to be coming from the brainstem. There are certain rules for vestibular learning. Vestibular learning works in both ways. If an animal is put on a magnifying glass, it learns to adapt to it. When the glass is removed, it learns to adapt without it. So it is working in both ways. So why is this working in both ways? What is happening at the molecular level? So this is labile and it is reversible. It depends on the time course of learning and time course over which your memory is retained. And it definitely requires visual sensory input. It's the minutest form of motor learning. We learned where in the cerebellum, at the synapse between the Purkinje and the parallel fibers with the climbing fibers coming to that synapse. We know it's happening there. But what is exactly happening at that synapse? Now for each potential site, be it the cerebellum or the brain stem, there are synaptic mechanisms which are different. So the cellular mechanisms at the cerebellum are something like this. How was this experiment conducted? They took a part of the cerebellum and they stimulated the Purkinje cell, the climbing fiber Purkinje cell synapse, or they just used the climbing fiber and applied glutamate. All this had started giving rise to motor learning. Now long-term depression though, according to Ito in 1982, the first study was described on an intact cerebellum, and the cellular and molecular mechanisms have been, after that, following that, have been seen, experimented only in reduced preparation. So this is a graph which shows a Purkinje cell being stimulated repeatedly, and initially there is a long-term, you can see after 30 minutes or so, there is a depression of the wave. Similarly, if you apply glutamate without any stimulation with climbing fibers, again you have a depression slowly. So this is what is happening. These were the experiments conducted, these were the graphs got. So it said that probably there is long-term depression happening there. Another mechanism called long-term potentiation has also been noted recently. Now, whether it be a long-term potentiation or depression, both are related to AMPA receptor trafficking. What is that? We'll just come to that. So it all depends upon the intracellular calcium. If you get a huge dose of intracellular calcium, you get a long-term potentiation. I mean, if it is a small intracellular calcium, you get long-term depression. I'll just skip this part. So this is the molecular basis of learning. So what is happening here? This is long-term depression. Here you have the climbing fibers and Purkinje which stimulate calcium entry into the cell, and through secondary messengers like arachidonic acid and DAG, there is protein kinase which gets activated. It converts your inositide triphosphate and converts it from the stores. Long-term depression happens. Second mechanism, if there isn't so much of hyperpolarization happening, the glutamate receptors get activated. This is also another mechanism. Again, through the same way, there is long-term LTD happening. Here, you have nitric oxide. This is another method which is not very well studied. They say that nitric oxide diffuses into the cell, and with the cyclic GMP mediated process, it causes long-term depression. Now, if you observe the long-term depression here and long-term potentiation, both can happen at the postsynaptic region. Now, this is probably why the motor learning can go either ways. Once your input is removed, it can again regress back to your normal. So, the question arises, why do we study long-term depression so much? Is it not possible for a person to compensate without this? So there have been studies which have shown that this is absolutely required, and there have been other studies. These were interesting. When you block the long-term depression, when you block the protein kinase, the long-term depression still happens. The motor learning still happens, but it takes a longer time. Now these studies somewhere show us that probably cerebellum long-term depression is not the only way this is happening. So this is why the fallacy. We don't really know exactly the site at which this is happening. Now the brainstem mechanism, I'll just show it to you in a video. It depends upon the AMPA receptor. Now here you have the AMPA receptor and the NMDA receptor, and that is the glutamate at the presynaptic channel. Now if there is only a little amount of glutamate released, it binds only to the AMPA. Here the other receptor is still blocked by a huge magnesium ion. The calcium cannot enter. So there is a certain amount of long-term potentiation happening. Now if there is a stronger current, if there is a very strong current coming and stimulating it, then what happens? There is lot of sodium ion entry through this. There is a huge action potential. These sodium ions will cause the magnesium ion which is blocking the NMDA receptor to be expelled out, and a huge influx of calcium comes in, because of which there is a hyperpolarization and a long-term depression can occur. Now, most important is this can happen over and over and over again, but it has to be consolidated. These memories have to be repeatedly consolidated in a certain central pathway. So, where is this central pathway? So, what is consolidation? Basically, it makes the memory resistant to disruption. After this, the person is supposed to be adequately compensated. Now, this pathway, this central receptor for long-term consolidation could be either in the cerebellum. It's shown that lot of long-term memories are stored in the cerebellum, and short-term memories also are stored in the cerebellum, but later they are pushed onwards to the brainstem. Now, compensation for vestibular damage, how does it occur? There are static symptoms. That is, at rest, when the patient is sitting, there is a nystagmus which beats towards the affected yaw. And there is a head nystagmus in which the patient tends to fall on one side. These are static symptoms, and they kind of, in a few hours, they somehow reduce and ameliorate. The dynamic symptoms, as the patient is walking, turning the head towards one side, these are the symptoms that require a motor learning. They have a longer recovery. And this is the basis for the Halmagyi head impulse test. And how? When there is a decompensated peripheral pathway, a sudden head movement like this will not be compensated. And that is why you do the head impulse test, because until this pathway is compensated by motor learning, the head impulse test will continue to be positive. And hence, they say that if the head impulse test is positive, it's done at a very high frequency. Only then it is a peripheral lesion. You have to do it at a high frequency. Now, last but not the least, you have cellular mechanisms of compensation in the 8th nerve nuclei. This is totally new, and they have discovered 4 ways that it could be compensating. One is the intrinsic mechanism. As soon as the input from the 8th nerve is cut off, the medial vestibular nuclei starts producing currents which start potentiating and helps in motor recovery. Another is synaptic mechanism. Here, normally, when the 8th nerve is normal, it stimulates the GABA receptor. Now, GABA receptor is an inhibitory receptor. So, the GABA receptor, when it's stimulated, it continues to inhibit. But as soon as the vestibular nerve is removed, say in a section, the GABA receptor stops functioning. So, there is no more inhibition. So, that's why probably from the synaptic mechanism, the GABA receptor gets inhibited and there is a long-term potentiation happening. Axonal reorganization. All this is happening at the 8th nerve. Now, we know there is a certain mechanism happening at the cerebellar level, certain mechanism happening at the brainstem level. This probably could be happening at the 8th nerve. Axonal reorganization means that if a particular axon, a particular nervelet to one semicircular canal is cut off, then the other canals start sending axons to compensate for it. And lastly, stress. It says that glucocorticoids that are released during these stressful labyrinthine conditions could also be helping in motor learning. So, to summarize, it's motor learning of vestibulo-ocular reflex is completely guided by vision. So, vision is essential. What we know and what we don't know here. Both hypotheses, the cerebellar as well as the brainstem hypothesis, have not been completely explained in experimental data. Hence, probably the slightly confused look on what exactly the topic was. So, the studies also indicate, like I told you, latest studies indicate that the 8th nerve nuclei might be having these sites. Long-term memory is stored in both the cerebellar cortex and in the brainstem. Short-term memory will initially get stored in the cerebellar cortex and then it will shift to the brainstem during the phase of consolidation. Cellular mechanisms involved, baseline, are long-term potentiation and depression. And the most effective tool to learn this is unilateral labyrinthectomy, because it is a very simple 3-neuron arc which can be stimulated once the labyrinth is gone, and there is a precise motor output which we can measure by a video nystagmography. So this is what we currently know about the motor learning. Thank you for your patience.